Introduction. Intended for healthcare professionals, this explainer video covers the emerging information on the BA.2 sublineage of the Omicron variant of the SARS-CoV-2 virus, the causative agent of COVID-19. This explainer video is a follow-up to a previous video on the mutation profile and pathophysiology of the Omicron variant. You can review that video by clicking the link in the description. The Omicron variant of the SARS-CoV-2 virus was first reported to the World Health Organization in late November of 2021. Due to the concerns related to the number and type of mutations in this variant's genome, the WHO and CDC classified this novel variant as a variant of concern, or VOC. Over the next 2 months, the Omicron variant spread worldwide, causing unprecedented increases in people testing positive for COVID-19. Across the world, the Omicron variant has now replaced the prior, Delta variant. Evidence suggests that the Omicron variant causes a less severe form of COVID-19, mostly limited to the upper airways. Given the high efficiency of spread and the ability to evade pre-existing immunity, Omicron continues to drive an increased number of patients requiring hospital care. Omicron sublineages. The Omicron variant has 3 major sublineages, BA.1, BA.2, and BA.3. The BA.1 sublineage is the most frequent with the typical Omicron mutations. Unlike the Delta variant, the BA.1 sublineage of Omicron was associated with a deletion mutation S69/70 that causes an S gene target failure, or SGTF, in certain PCR reactions. SGTF is defined as a PCR test where the N and ORF1 genes are detected, but the S gene is not. In certain parts of the world, SGTF rates were used to track the replacement of the Delta variant by the Omicron variant, most of which were of the BA.1 sublineage. The BA.2 sublineage arose at about the same time as the BA.1 sublineage. While the earliest cases of the BA.2 sublineage are detected in East Asia, it has now been detected worldwide. The BA.3 sublineage has not been widely reported. BA.2 sublineage. In addition to the lack of the S gene deletion at positions 69 to 70, the BA.2 sublineage has 28 other mutations and deletion at positions 25 to 27. Given its genomic difference, it has been suggested that BA.2 should receive its name based on the Greek alphabet. In Europe, BA.2 appears to be the most widespread in Denmark, constituting 65% of the new cases. As of early January of 2022, in Denmark, the BA.2 variant is growing at +11% per day, as a ratio to BA.1, the legacy Omicron variant. In the United Kingdom, the BA.2 variant was growing at +20% per day as a ratio to BA.1. In the US, BA.2 has been detected across several states. In the lay media, the term stealth variant has been misattributed for BA.2. While the word stealth suggests that BA.2 escapes laboratory detection, the reality is that all variants of SARS-CoV-2 continue to be detected by PCR reaction. Let us try to understand the reason behind this confusion. As discussed earlier, the BA.2 sublineage does not have SGTF. Therefore, if the BA.2 starts to replace the BA.1, SGTF rates can no longer be used by public health authorities as a proxy marker to track the replacement of the Delta variant. This phenomenon may not be a significant concern, since the Omicron variant sublineages already constitute more than 95% of newly detected COVID-19 cases in the United States. According to the CDC, currently, there are insufficient data to determine whether the BA.2 lineage is more transmissible or has a fitness advantage over the BA.1 lineage. Danish healthcare authorities had not seen differences between BA.1 and BA.2 in hospitalizations or severity. Norwegian studies show that the virus in the upper airways is similar in those infected with BA.1 and BA.2. According to the United Kingdom Health Security Agency, as of early January, the growth rate of BA.2 was +126% per week. The secondary attack rate is 13.4%, slightly higher than the 10.3% previously seen with BA.1. An initial study by the UK Health Security Agency found that vaccines afford similar levels of protection against symptomatic disease by BA.1 and BA.2, and in both it is considerably higher after 2 doses and a booster than 2 doses without a booster. Takeaway points. As always, the SARS-CoV-2 virus continues to evolve, and new variants and sublineages continue to emerge. The emergence of BA.1 and BA.2 is a part of this phenomenon. At this point, there is insufficient evidence to conclude that the BA.2 sublineage is substantially different from the prior BA.1 sublineage. However, if the BA.2 sublineage has a substantial transmission advantage, it might prolong the ongoing Omicron surge. At this point, the emergence of new Omicron sublineages is unlikely to interfere with our ability to detect the SARS-CoV-2 virus in the laboratory setting. RT-PCR methods remain sensitive and specific because they use multiple genetic targets to detect the SARS-CoV-2 variants.